We will discuss what is better for our oral health, water, coffee or cola. And as a general principle, we should say about thick saliva. Thick saliva, when saliva has high viscosity, is worst saliva. Worst because of potential increased risk of many diseases. For example, when saliva thickness is increased, it increases bacterial colonization and increases bacterial infections. It causes bad breath also, because when saliva is thick, lots of bacteria are trapped and colonized, and they cause different gases, and these gases we feel as bad breath or halitosis also. And tooth decay, thick saliva increase risk of tooth decay importantly, and even it increases risk of oral cancers and esophageal cancers. And now let's say about water, what water is doing. Water replenish saliva levels. It's important. It neutralizing mouth acids, and when neutralizing acidic environment, it's unfavorable environment for bacterial growth, and it lowers viscosity of saliva. It's also unfavorable environment for bacteria, and it wash bacteria easily. That's why it decreases risk of gum disease, decreases risk of cavities also, and it decreases risk of gum disease around 30%. It's important reduction of gum disease risk. So what is best scenario? If you intake water frequently and small portions, it considered best you can do during the day for your mouth, because it creates unfavorable areas and environment for bacteria growth. And now let's say about caffeine and coffee specifically. Coffee has some positive effects. For example, it contains tannins, and these tannins have antibacterial action, and they can neutralize some bacteria. But in big picture, caffeine and coffee generally is not favorable for our oral cavity, because it decreases saliva flow around 36%, and it causes dry mouth and thick saliva also. And it has diuretic action, and we lose fluids from our body via urine. So it creates of course dehydrated environment in our body also. And if you're drinking coffee and you don't drink enough water, there is chance that your mouth will be dehydrated, and dry mouth risk will increase, and thick saliva will be very prominent, and acidic environment is created, and acidic environment is very favorable for bacterial growth, and it causes gum disease also, and tooth decay also. So acidic environment and thick saliva, these two components, and dry mouth, they are worst for our oral health. That's why we should avoid them. And it's recommended that intake coffee in moderation. It's around 3 to 5 cups per day, but if you cure your oral cavity, you may decrease this number even further. And about cola, if we say that coffee has some positive effects on our oral health, cola has nothing positive, only negativity. And when person has erosions, 60% of such persons who has oral and tooth erosions, they are cola drinkers. And cola creates acidic nature and acidic environment in your mouth, and it's a very favorable area for bacterial growth. It increases risk of tooth decay, gum disease, also different types of disease of gums, including growth in the mouth, including some benign and in rare cases but still cancers. So we can say that cola has only negative actions on our oral cavity. It causes dry mouth also, it causes thick saliva, so nothing positivity here. And now assess which is better and which is best. First, water is best, especially if you drink water small amounts and several times per day, and frequently. It's best for your oral health. Second is coffee. You can intake some coffee and it's okay, but cola is worse for your mouth and for your oral health. So it's better if you avoid cola and coffee on moderation. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my video, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.